There are more COVID-19 patients in North Alabama hospitals now than ever before, and the uphill battle continues for those fighting the pandemic on the front lines. Infectious disease specialist for Huntsville Hospital, Dr. Lee Hassoun, joins us now to talk more about the issues. Thank you for being with us tonight.
Thank you for having me.
Dr. Hassoun, let's talk about the numbers. How serious of a situation are local hospitals dealing with right now?
Naja, it's very serious, and it's getting into a way of we seeing significant number of patients who get admitted to the hospital, but at the same time admitted to the ICU with a higher risk of mortality and morbidity as well. These patients are staying longer in the hospital, and unfortunately, it's affecting everybody between healthcare staff, management of these patients, but also it's affecting the non-COVID patient in addition.
Let's talk about the vaccines. There has been promising news on that front. So when will North Alabama receive the vaccine?
So as you know, the FDA is meeting on December 10, and I think the moment it gets approved, we'll be able to have access to it pretty quickly. So I'm expecting probably by around December 15, possibly before that, just depending on how fast this approval happens, and hopefully we'll see it arriving sooner after that.
How much will we get, and how much in reality do we actually need?
Yeah, I mean, we really don't know exactly how many we're going to be able to get. You can ask for as many as we can, and hopefully we'll get, but I can tell you initially, especially with the production they have, and they want to distribute it to all over the United States, as well as there's requests for other countries. We probably, to start with, we're going to have some limited supply, and eventually we'll get more and more. So it's hard to tell how much they're going to give to North Alabama or the hospitals in the area.
Has Alabama finalized who will get it first, and when do we anticipate it being available to the general public?
Yeah, so I think at the moment the people who's going to get it first would be those elderly who's in long-term care facilities, as well as a healthcare worker who's on the front line, who's in direct or indirect contact with COVID patients. I think for the general public, it's probably going to be around February, March to see it. You hope it will be earlier if there is going to be a production more of the vaccine and more vaccine, different ones approved. We might get it a little bit earlier. It's just going to depend on Moderna and Pfizer and other companies who get the approval. But probably look at February or March.
Any other final thoughts that you would like to share with us tonight?
Yeah, Naja, I mean, it is very concerning of what we're seeing. And I still hear from patients come to the hospital that their symptom, they thought it could be allergies because they have a bit of sniffle or sinus problems. The most common problem at the moment in North Alabama is COVID-19. So any of us had symptoms of upper respiratory tract, whether runny nose or cough, they should get tested as soon as possible.
Important reminders, life-saving reminders, really. Dr. Lee Hassoun, infectious disease specialist with Huntsville Hospital, thank you so much for your time and insight tonight.
Thank you so much.